Okay, we're going to go in 3, 2, 1. Patrick, you can come in.
Wow,
How you
it's
doing?
been a little while.
4 years, just over 4 years.
4 years.
Nice to meet you again.
Wow, good to see you. How have you been?
Very good, thank you.
Yeah?
Yeah, really good.
How has life been treating you?
Since the up, brilliantly. Up,
Yeah.
no downs.
Yeah.
Been really good, yeah, positive.
How has it kind of made a difference to you? And
Well, before, as I speak to you, I used to not go out at all. I was like a recluse, wasn't I? I told you that years ago.
Yeah.
Didn't go out. Now, I'm never in. I'm out all the time, you know, socialising, holidays.
yeah?
Yeah.
I remember you saying like you'd never been on a holiday for 10 years? Maybe even longer than that.
15, 16 years.
15, 16 years.
I've had 3 holidays so far.
Wow.
Yeah, just come back. Well, come back a few months ago. Yeah, great. Yeah, just out all the time with son and family and friends.
Yeah.
It's just been got my life back. You know.
That's great.
Where
That's really great to
before
hear.
I never had a life.
Yeah.
You know, it's really. I mean, I didn't go into it too all the details, but
Yeah.
it was very dark. You know, gloomy, recluse.
Yeah.
I just can't thank you enough.
Oh, you're so welcome.
Honestly, I can't thank you enough.
It's such
changed
a
my
pleasure
life.
to help you.
And my family's life and all my friends.
Oh,
Really appreciate it.
what?
You know, I was just very surprised you got contact. So I was going to come in, I thought, they discharged me.
Yeah.
I was going to pop in just one day and just say hello, but didn't
Well,
know.
we had some difficulty getting in touch with you and finding you, and like one of my team, Kay, he went to enormous lengths to like find you.
I know.
And so I think, well, I'm so happy that it's made such a difference to you. And
It's 100% difference. Got my life back. Before, I never had one. It's changed me it's changed my life.
when I first met you, and I remember you saying like you just kind of go to work, come home, go to work, and that was pretty much how things were for years.
Yes, because people used to just stare at me, call me, and just ridicule me, and I didn't want to go out.
Yeah.
Did be shopping at night, things like that, and it was like a prison sentence, really. Might as well have been in prison for 16 years, you know.
Yeah.
I never had a life.
Yeah.
Just wouldn't go anywhere. But now, because I never had the knowledge to find help, you know.
Yeah, I think you were trapped in that way of life, and
Yeah.
in a way, when I first saw you, I thought, I could see the effect it was having on your kind of quality of life, but really it was something that could be treated, it could be helped, it just wasn't something that you were aware of.
No.
And so in a way there was something that we could do. And I mean, in a way it's interesting to know how it got to that point. Like, had you ever gone to your GP or?
No, I didn't really think they could help. I mean, I didn't know there was help out there for this kind of condition.
Yeah.
Until I started researching it.
Yeah.
I found a lot of American clinics.
Yeah.
And I knew there was help.
Yeah.
And this was probably about a year or two before I called here.
Yeah.
So it was that 2000, that's about 2020, 2019, 20. And I started looking at it and I thought, there is help. It can't be just in America, it must be in the UK.
Yeah.
And then I just started looking around. I did actually phone this clinic about a year before.
Yeah.
And a lady was going to get a consultation with me, but I didn't follow it up. I sort of put the phone down and I said, Pat, I thought myself, I got nervous,
Yeah.
But then, sort of a year later, I said, something's got to be done here. I was in a stage where I'm crossroads.
Yeah.
Either go down that dark route or I get help. And that's when I phoned.
Yeah.
And brilliant, first thing I've ever done.
Yeah.
Yeah.
Well, that's an extraordinary story, in that there were so many years, like, you know, you didn't go out except to work and then home. And
visit my son, yeah.
And, I mean, looking back now, like, how was your kind of quality of life? Like,
what then?
Yeah.
I had no life. It was no life. It was a get up, go to work, come home, stay in. Didn't go out. Didn't go out in the sunshine.
Yeah.
Just didn't want to go out.
Yeah.
Because I knew if I had to go up, obviously had to get to work. I wouldn't sit down on the train. I'd be standing all the time. Even if it was like an hour's journey, I'd be standing in the corner, holding on the rail with my head down, or with a paper, you know, the masquerading, that sort of thing.
And perhaps was that because the rare times that someone might see you, it would end in confrontation?
Yeah, when it got sort of near before I phoned the clinic, I walked down the street, kids would mock. You know. I mean, I've done children are children. You know, but adults with comments. You know, if I went anywhere and stare at you in the shop, they'd be looking at you. You know, and I just felt really.
People can be very mean.
Cruel. It'd be cruel, but you do feel really bad, you know, inside.
Yeah.
You know, and I say, I went one shop and this American guy came up to me and he did say to me, "What you've got, there is help." And I thought, why would he come up and say that to me?
Yeah.
Well, you know, he just walked off, you know.
Yeah, yeah.
So that's when I started looking, you know.
Yeah.
Probably the kick I needed to get you going, sort of thing.
Yeah.
But I'm grateful for him, really.
Yeah.
Because I probably would be, I don't know. I may have found you. I may not.
I think it was like fate was like, you know, sometimes I believe things are meant to happen.
Yeah.
And so like when you came to the clinic and had a look at your nose, I was genuinely excited to help you because I thought, you know, you were someone who could definitely help and improve like your physical kind of appearance. But then so much of your quality of life was kind of based on your kind of appearance. And so
that's the first thing they see is the face.
Yeah.
You know. I mean, when I came in for the consultation, I was sitting out there, I'm sweating, my hands are sweating, I think, they might be able to do nothing for me.
Yeah.
You know, I'll go in, I'll have a chat, they'll say, sorry, we don't, but obviously you went, yes, we can help you. And I was like, it was like a weight off my shoulders, really.
Yeah.
You know.
So now in a way, it's that little time further on. How has your kind of quality of life changed now? Like, so you've been for a few holidays. How was it like going on a holiday after like 15 years of not going on holiday?
Well, the first time I went was 2000, I finished the operation was 21, wasn't it? 2021. I didn't go in 2022 because I can't remember why, but I went in late 2022, 23. And that was completely different. I've not been in an airport for 20 years and all procedures have changed there as well. I think, you could do this. Years ago, I didn't do this. Just show your passport. And it was great. You know, I went on holiday, I had a great holiday. And I went again sort of in the April, I went for a week. And then I just come back from, I was in Rhodes in the end of August.
Right.
Just come back. And that's where, when I went home, someone said, a doctor's been round to see you. And I was like, sorry. I didn't know a clue who he was talking about.
Yeah.
And another neighbour said, and he gave me a bit of paper and had your name on it.
Right.
And I thought, right. It's strange how it seemed to happen, didn't it?
Yeah.
But it was great. The quality of life's brilliant. Now, you know, I could do anything I want, really, now, you know.
That is awesome.
Yeah.
So, I mean, in a way, it's nice to be able to tell the story because, of course, if there are any other people out there who may have a similar condition, you know, there is treatment that can really improve things and give you a normal looking nose, and really the more the word is out there, the more people can be helped. And then how was having, because you hadn't had much in the way of surgery previously, how was coming in to have surgery, and how was that kind of experience?
Well, actually on the day?
Yeah.
I was nervous as hell, really. Because can you describe to me what you were going to do?
Yeah.
He said it was he said it's like a graze on your knee. and it will heal like it, you know, I mean, I know that sounds okay, but I knew the surgery. I was nervous as hell. But it went brilliant because I got home that night because my brother-in-law picked me up, and I don't even think I took a painkiller. I never had no pain.
Yeah.
And I thought I could be really agony,
Yeah.
but I never. But then when I took the bandage off that night,
Yeah.
I looked at it, I went, it just looked like I've been a few rounds with Mike Tyson.
Yeah. Yeah.
But then after taking all my treatment, in putting all this, I had all the medical thing for the care afterwards. It was a week or 2 weeks care, medication. Yeah, it's sort of just changed brilliantly, you know.
Yeah.
It was just so quick.
Yeah.
6 weeks, and I come back. I think I had my post-op 6 weeks.
That's right.
That's it. And there was just a section there, and that's when they said I could have some red light therapy.
Yeah.
And I come back, and I had about 8 of them, I think.
Yeah.
8, 9, and it was brilliant.
And then it just settled down. And
Yeah.
And so in a way, it's an unusual condition where the skin gets thicker and thicker.
Yeah.
Like, and in a way, there's a kind of process by which the skin, not the underlying anatomy, but the skin thickens over like months and years, and so the nose kind of grows like superficially. But in essence, we shave down all of those layers of the skin to get to the actual original nose before those things happened. So I think, looking back now, is there anything else that you think would be helpful to any patients who might be watching, who've
got the same sort of condition? Yeah. I get help. I mean, I wish I'd done it years ago. You know, because I wasted so many years.
Yeah.
Because when it all started off with a little bump first, and then it just gets worse over time. You know, gradual. But you look in the mirror, you can see it. You know.
Yeah.
But if you catch it earlier, is it obviously it would help, wouldn't it? Or I thought it'd help. I don't know.
Yeah.
It must
do.
I would say if you get anything, just get help as soon as you can.
Yeah.
Because I didn't know there was help out there.
Yeah.
It's just having a bit of knowledge.
Yeah.
You seek knowledge about it. I would say to anyone.
Yeah.
Because they asked me a question. If you had old Patrick here in front of you with that condition, what would you do? And I'd say, get help straight away.
Yeah.
Don't live like I did.
Yeah.
And you don't have to.
Yeah.
You know, it's needless, really. It's a needless waste of life.
Yeah.
So we're at time, you can just get help and then touch wood, everything will be okay.
Well, Patrick, I love doing surgery to make a genuine difference to people, but I don't think there's many patients who have like the level of improvement in quality of life as you, because most people can enjoy holidays and go away and go out and socialize, but when you have something that affects your physical appearance in such a way, of course it can impact absolutely everything. But wow, like to be able to like do things like normal after so many years, that's just like wonderful. And I'm so happy for you.
Well, thanks down to you and your team.
Thank you.
No, I was just great not doing it years ago.
Yeah.
Most I did.
Great.
I've had one question I mean to ask you. When we had a consultation, you did say there was a possibility in you said about 10 years, maybe longer, it could possibly come back.
Yeah.
So I do still worry about that.
Yeah. I think seeing you today, Patrick, after several years, I really don't think that's something that's going to happen. But in a way, no one can ever 100% predict the future. And of course, where there's kind of genetics and there's a process by which the nose can kind of gradually increase in size, theoretically, that process could start again. But the fact that we did the procedure and the fact that we shaved down the layers of the skin, it also created a scar in the skin.
Yeah.
And that's actually kind of a protective part of the nose. That kind of extra collagen, that extra scar tissue will stop that process from coming back. And considering it's been stable now for several years, I don't think it's now suddenly going to change again.
Okay, that's good news.
Yeah, that is good
news. So I remember your answer to that also, I remember you to say, if it does happen, we'll just do the procedure again.
That's right.
That's right.
But I don't think that's going to be necessary.
That's good.
So Patrick, in this video we took during the actual surgery, you can see we're peeling away this thickened skin, and it's like peeling away the layers of the onion to get to the inner core, the inner anatomy. So it's a little bit gruesome watching this because literally centimeters of the nose being peeled back, but that's what it took to improve your nose.
Just shows the size of it, because you see the hand's almost round it.
Yes.
Where they're holding the nose while you're cutting away. So you just see how big an operation it is.
Definitely, that's absolutely right. So we're using monopolar to like shave down the layers of the skin, and we have like suction to keep taking away the smoke that's kind of generated from this. And this is why it took such a long time, because you can see it's like literally we're doing millimeter by millimeter, and to cover that whole area, it's just going to take a long time.
It's amazing, isn't it?
It just thickens the skin.
Yeah.
Patrick, I just want to say thank you for coming in. It's wonderful to see you, and I'm so happy it's made such a difference to your quality of life. It's very meaningful. And yeah, but thank you for coming in today.
Thanks for having me. Yeah, it's nice to see you. Just hope this helps other people.
Absolutely.
You know? I think you would.
Yes.
I do.
Yeah.
Nice to see you.
Likewise.
Yeah.
Okay.